The secret to fixing carpal tunnel syndrome with exercises lies in the anatomy. We need to address everything within that wrist canal: the finger flexors, the thumb flexor, and the median nerve, plus the 4 common nerve irritation sites further up the arm that can add to that nerve irritation. So here's the 5 exercises to give you the quickest results. The carpal tunnel is a space between the bones of your wrist and the transverse carpal ligament that crosses them. If inflammation, cysts or scar tissue clog up that space, your median nerve can become irritated or even crushed. This can cause pain, numbness or tingling in the lateral 3.5 fingers, especially at night, and sometimes even extending up the arm, decreased hand dexterity or strength, even wasting away of the thinner part of your hand at the base of your thumb. If you start to get noticeable weakness in the fingers, or permanent numbness, or even wasting of these thinner muscles at the base of your thumb, go straight to the doctor, because if the nerve becomes too crushed, it may never heal. But if the symptoms are more light and intermittent, there's a very good chance that these exercises will help. The first step is always avoiding or significantly reducing the cause, where possible. Repetitious motions like gaming, texting, typing or playing musical instruments, forceful gripping like using hand tools or biking, vibration tools, prolonged wrist flexion, especially in bed, and systemic conditions. If you tend to get a lot of symptoms at night or first thing in the mornings, you may have a habit of sleeping with your wrists curled up a little bit, and that can aggravate things. So a wrist brace to keep your wrists straight, just worn only at night, can help. In the first 3 exercises, we focus on the flexor tendons of the fingers, the long flexor of the thumb, and the median nerve, all at wrist level. Sliding these tendons and the nerve through the tunnel can break up adhesions and scar tissue and move fluid or space-filling soft tissue like cysts out of the carpal tunnel. But before we start, a word of warning. In more serious cases, doing the full quota of exercises the first day will be too much. So just start off by doing 20% of the number of exercises the first day, then 50% the second day, and then if the third day you're still feeling good, then you can do the full quota. And in the more serious cases, I would recommend icing the wrist at the end of the day for 10 to 15 minutes after the last set of exercises. Let's start off with the finger flexors. 2 different finger flexors pass through the carpal tunnel and they attach to different parts of the fingers, so we need to use different variations of finger movement to get the maximum sliding through the tunnel. Exercise 1 is slow progressive finger flexion. Start off with straight fingers and thumb, then move to the claw or hook position, then a fist with your thumb covering over your fingers. Repeat 5 times slowly the first day, 1 set of 10 the second day, and then start doing 3 sets of 10 per day at morning, lunch and bedtime. I'll put a summary of the amounts of each exercise in the description below. In exercise 2, we start straight again, then move to the puppet position. Just notice the thumb placement. Then a fist variation with the last joints of the fingers straight and the thumb back out again. The thumb movements in this exercise get the thumb flexor tendon sliding more. Repeat 5 times slowly the first day, then 10 times the second day, then 10 exercises 3 times a day like exercise 1. Next, we want to get the median nerve moving through the wrist tunnel, but with nerve movements we want to be gentle. So just move very slowly through these positions, but only up into a slight stretching sensation and no more. If you get any pain, numbness or tingling into your fingers, ease off a bit. Exercise 3. Begin with a loose fist, then slowly extend the fingers and the thumb until the wrist is extended too. Spread all the fingers, then externally rotate the forearm, and then gently push on the thumb and the index finger to pull the median nerve through to its end position. Don't push too hard and don't hold this end position for more than a second or 2. Repeat 3 times slowly the first day, 5 times the second day, and 10 times once a day thereafter. In exercise 4, we start sliding the median nerve more in both directions, and we address other possible sites of nerve irritation. You see, in carpal tunnel syndrome, Pressure on the median nerve can occur in multiple locations, and we call that the double crush phenomena. Common sites include under the pronator teres muscle in the forearm, the pec minor, the scalenes muscles in the neck, and the first rib. So for exercise 4, start off by drawing the median nerve towards the neck by leaning the head away from the arm and bending the elbow, wrist and fingers. Then slide the nerve in the direction of the hand by leaning your neck towards the arm as you extend the elbow, wrist and fingers. Again, do this gently. If there are adhesions, this will pull the nerve, and stretching the nerve too much will irritate it. So if it hurts or tingles, ease right off, or even stop. Repeat 3 times the first day, 5 times the second day, and 10 times once a day thereafter, just like in exercise 3. Now you may see an exercise to stretch the median nerve that looks similar to exercise 4, but where the neck leans away from the extended arm. But I don't personally recommend this. This is a nerve stretch, not a nerve glide, and stretching an already irritated nerve just causes too many cases of exacerbation for my likes. Exercise 5 is for more difficult cases that aren't responding to the first 4 exercises. It focuses on mobilizing the first rib and stretching the scalenes muscles. Lay a towel right in at the angle of your neck on the side of the carpal tunnel problem, pull down with both hands, and then slowly stretch away from the towel 5 or 10 times slowly. Well, what other things can help? Well, magnesium has been shown to decrease nerve pain and promote nerve healing, so I'd recommend taking a magnesium supplement daily for a few months. And poor circulation can lead to fluid buildup in the wrists, so make sure you do some general cardiovascular exercises like fast walking or swimming. If there's no improvement at all after 4 weeks of doing these exercises and avoiding all the causes of carpal tunnel syndrome, I'd seek medical advice just to make sure that you don't get any nerve damage. It is easy to confuse carpal tunnel syndrome with problems arising from the neck, which can give you tingling into the fingers at night too. Nerves can become irritated by dysfunctional joints in the neck, and this can affect any of the fingers, but the majority of neck-related problems will affect the little finger and the ring finger more. So just be aware of this other possible cause of pins and needles into the fingers. Now there are some modern surgery techniques that only involve keyhole surgery in the distal forearm and some local anaesthetic, and that can decrease your risk and your recovery times. So if you do end up needing surgery for your carpal tunnel syndrome, you can ask about that option. But that's it for today. Hope you liked the video. If you did, please consider liking, commenting and subscribing to support the channel. Cheers. So here's the best 5 exercises to get the quickest job. Make sure you do some general cardiovascular exercise like fast warming or swimming. Fast warming? Did I say that? The finger flexors, the thumb flexor, the thumb flexor.